Holmium laser prostatectomy, or HOLEP, is an operation we do for men with large prostates that are obstructing the flow of urine from the bladder. And if you imagine the prostate as an orange and you pee through the core of an orange, what we do is we go in and we remove the flesh of the orange and leave the peel. And we do that using a laser, enucleating the flesh of the orange and pushing it into the bladder. And then we mash it up with a special instrument and remove it. So the end product is that we remove the obstructing part of the prostate and leave the outer shell, enabling men to pass urine much more freely. And it's the best operation for men with bladder outflow obstruction, in my view. Well, men with the largest prostates are the best candidates for Holmium laser prostatectomy. The European and British guidelines recommend patients with very big prostates to have laser prostatectomy instead of the standard TURP, because TURP involves blood loss, and also there's a risk of irrigation getting absorbed into the circulation. It's not a major operation. It takes about an hour to an hour and a half to do. The patient is asleep during the procedure, and there are no cuts. The patient goes home the next day following surgery, passing urine well in most cases. Major surgery, it's a subjective view, isn't it? I don't think it's particularly major, no, compared to other surgeries. The patient doesn't really need to prepare in any particular way. They need to attend the normal pre-admission investigations, and the main thing is to prevent any infection in the urine before procedures. So when one has a catheter in, that's quite common to have an infection, but we cover that with antibiotics during the procedure. But otherwise, there's no specific way of preparing other than to stop also blood thinning drugs if they're on any. Well, patients wake up direct from surgery feeling well without any pain. We normally like to keep them in overnight, and the vast majority of patients will go home passing urine after removal of the catheter the day after surgery. The waterworks may not be perfect for a few weeks while it all settles down, but the patient's walking around the next day. We normally recommend patients to take a week or two off work. But having said that, if patients work, if they really need to work and they can work from home, then they're not going to cause themselves any harm by going to work, but generally a couple of weeks. Well, the benefit of the major benefit of the HOLEP operation is it removes all the obstructing adenoma of the prostate, leaving just the shell. So if it's done correctly, no, the prostate doesn't regrow. And that's a major advantage compared with TURP, which, although the TURP is an excellent operation, it doesn't remove as much prostate tissue. So in big prostates, there is the risk of regrowth of the remnant tissue, which can later cause problems.